goitre control program was launched in 1962 based on iodized salt. After 20 years of operation, it was found that the prevalence of goitre had remained the same. Assessment of the problem by the ICMR showed that goitre is widely prevalent in the country. Besides the traditional Himalayan belt of goitre as a result, a major national program, iodine deficiency disorders (IDD) short form, control program was initiated in which nationwide rather than area specific use of iodized salt is being promoted. It was decided as a national policy to fortify all edible salt in a mm, manner by the end of eighth plan. The essential components of a national IDD program are use of iodized salt in place of program. Our use of iodized salt in place of program, common salt monitoring and surveillance, manpower training and mass communication. Integrated Disease Surveillance Project. Integrated Disease Surveillance Project IDSP short form is a decentralized state based surveillance system in the country. This project is intended to detect early warning signals of impending outbreaks and help initiate an effective response in a timely manner in urban and rural areas. It was also provide essential data to monitor progress of ongoing disease control program and help allocate health resources more efficiency. Efficiently, the project was launched in November 2004 with the help of World Bank assistance for a period of 5 years. It was extended by 2 years in the year 2010 and now it continues during 12th 5-year plan by domestic budget. The classifications of surveillance in IDSP is as follows. Syndromic diagnosis. Diagnosis is made on the basis of clinical pattern by paramedical personnel and members of the community. Preceptive diagnosis, the diagnosis made on typically history and clinical examination by medical officer and confirmed diagnosis, clinical diagnosis by a medical officer and or positive laboratory identification. Syndromes under surveillance. The paramedical health soldier will undertake disease surveillance based on board categories of presentation. The following clinical syndromes will be under surveillance in IDSP short form. Number one, fever. Less than 7 days duration without any localizing signs. uh, Part B, with rash, with alerted sensorium or convergence, bleeding from skin or mucous membrane. Fever more than 7 days with or without localizing sinus, cough more than 3 weeks duration. Acute flaccid paralysis, diarrhea, jaundice, unusual events causing death. Unusual events causing death or hospitalization. These syndromes are intended to pick up all diseases listed under regular surveillance. At the level of the community, under the Integrated Disease Surveillance Project, favor with or without localizing signs, malaria, typhoid, GE, dengue, measles, cough more than 3 weeks, acute flaccid paralysis, tuberculosis, polio. Diarrhea, jaundice, cholera, hepatitis, leptospirosis, dengue, malaria, yellow fever, regular periodic services, NCD risk factors, anthropometry, physical activity, blood pressure, tobacco, nutrition, etc. Unusual syndromes, the core condition is under surveillance in IDSP or as follows: regular surveillance, vector borne diseases like malaria, waterborne diseases like acute diarrheal disease, cholera, respiratory tuberculosis, respiratory diseases like tuberculosis, typhoid, vaccine. Respiratory diseases like tuberculosis, vaccine, measles, preventable diseases, uh, polio, under eradication like polio. Other conditions, road traffic accidents, link of with policy captures, other international commitments, unusual meningeo and hepatitis, clinical respiratory syndromes, distress causing hemorrhagic fevers, death, hospitalization, other, other undiagnosed conditions. Senatal surveillance, sexual transmitted diseases like HIV, HBV, HCV, monitoring blood-borne outdoor air quality, large urban other conditions, large urban centers. Additional setting priorities is state may identify up to five additional conditions, for surveillance. The reporting unit is for disease surveillance or number one, subcenter health worker ANM reports all patients fulfilling the clinical syndrome from PHC, private clinic, hospital, etc. Number two, PSC CSC medical officers report as probably cases of interest where this cannot be confirmed by laboratory tests at the peripheral reporting units, and as confirmed when the laboratory information is available, as in case of blood smear plus a VE malaria and spectrum AFB plus VE tuberculosis. Sentinel private practitioners, district hospitals, municipal hospitals, medical colleges, sentinel hospitals, NGOs, medical officers report as probably cases of interest. National Mental Health Program. Number two, National Mental Health Program. The National Mental Health Program was launched during 1982 with a view to ensure availability of mental health care services for all, especially the community as at risk and underprivileged section of the population. Of encourage application of mental health knowledge is general health care and social development. The aims of the NMHP National Mental Health Program are prevention and treatment of mental and neurological disorders and their associated disabilities, use of mental health technology to improve general health services, and applications of mental health principles in total national development to improve quality of life. Thank you for watching.